community-based midwifery, and super excited to have everyone here. Yeah, so let's get started.
All right. Thank you, Chanel, and thank you all for being here for this panel. We are missing one panelist right now, but hopefully she will be able to join us soon. But we will go ahead and get started. So as Chanel mentioned, this panel is talking about how we're working in our communities to expand access to community-based midwifery care. We know that there's been a lot of conversation in recent years about the inequities in our maternal health system, the obstetric violence, the disrespect and abuse that our Black mamas are facing when they seek care in facility-based institutions like hospitals. And so I think this is a great time for a rich discussion about what's going on and how we can support those efforts. I know that just last Sunday, there was a demonstration at Queens Hospital about the death of Denise Williams, a mother that was simply seeking treatment for postpartum depression, and she died. Similarly, earlier this morning, Bruce McIntyre was talking about losing his soulmate, Amber Rose Isaac, and we have to make change, right? And so as we think about these lives that we've lost, as we think about how we can provide better care for our Black mamas and birthing people, and as we think about how we're going to combat the constant discrimination, bias, and racism that they're facing, we have a lot of folks that are thinking, how can I access care elsewhere? And so today, our panelists are going to talk to us about that very thing. And so I will just jump in and do some quick introductions, and we will get the discussion started. So first, Jamara, who has not yet joined us, but she will, but I'll go ahead and do a quick introduction for her. She is a community midwife who believes in the transformative and healing power of birth, and that every baby has a human right to human milk. Her mission is to do her part to build a movement for birth justice locally, nationally, and globally. She's the architect of the Birth Justice Framework, the Black Midwives Model of Care, and the Birth Justice Bill of Rights. She's currently the executive director of Southern Birth Justice Network, a nonprofit organization working to expand the birth justice movement and to make midwifery and doula care accessible to marginalized communities. She is also the co-founder of the National Black Midwives Alliance and a founding member of the Queer and Transgender Midwives Association. And she is currently producing a documentary entitled Legacy, Power, Voice, Movements in Black Midwifery. So we'll welcome Jamara once she joins us. We also have Leah Jones, who was born and raised in Louisville, Kentucky. She's a mother of one, a maternal health advocate, and a birth justice advocate or activist. Leah serves as Sister Song's deputy director and has dual roles within the organization. Birth justice and internal organizational management are both her passion and strength. And since 2018, she has led birth justice programming, birthing the Birth Justice Care Fund, and creating close partnerships that brought Mama Talk, labor intensives, the advanced skills doula trainings, and Titty Talk to the work of Sister Song. So welcome, Leah. And last but certainly not least, we are joined again by Carmen Mojica, who is a Black Dominican woman born and raised in the Bronx. She is a certified professional midwife, a writer, and reproductive justice activist with a particular focus on birth justice. She utilizes her experience as a midwife to raise awareness on maternal and infant health for women, highlighting the disparities in the healthcare system in the U.S. for women of color. She is one of the co-creators of Bronx Rebirth and Progress Collective, a group of Black mothers, doulas, and organizers who aim to build alternate solutions outside of the system that protect and honor birthing people in the Bronx and their families. Welcome, Carmen. So let's just jump right into the discussion. In kind of the framing that I did for the panel, I mentioned community-based midwives or community midwives. Carmen, I would love if you would do some level setting for us and help folks understand What is a community-based midwife, and why is it important that we use that phrase, that term, with intention?
Yeah, thank you. So community midwifery to me has meant, at least in the last couple of years since I've been doing work here with the midwifery certified professional midwives, is I feel that it calls upon the original model of midwifery that we experienced here in this country before the near eradication of Black midwives, or rather, better said, pushing the Black grand midwives into the shadows and the development of modern midwifery. Community midwifery is entrenched in the neighborhoods and in the community itself. Midwives who work within the community are known by the members of their community. They're trusted already. They often are actually trusted individuals that are probably healers or have done some type of work, community work or organizing already before they took on the midwifery title. And so they have what has come to be told to me as social capital, where they already have established within their networks that they are a trusted, safe individual to seek care for. Oftentimes, we serve the role of not just giving reproductive health advice. Folks come to us for scrapes, cuts, all of the things that fall under health. And so I feel that we have been using that now here in 2021 to recapture, right, the idea of how midwifery was originally existed. So when we say community midwifery, we're talking about a very grassroots, community-based approach that's juxtaposed with hospital-based midwifery, which may be in the community, but those hospitals are not of the community. Right, so that's the difference. It doesn't mean that the midwives that are in the hospital do not care about the community in the same ways as those of us that have sprung organically from the community, but there is a separation that occurs because of the institutionalization.
Mm-hmm. We can't hear you. Mm-hmm.
Oh no. No, we can't hear you yet.
Uh-oh.
There you go. We heard you for a second. Okay, maybe pop out, pop back in. All right. Well, while we work through these technical difficulties called the internets, we can continue the conversation. Leah, tell us a little bit about the work that you're doing down in the South and how it's impacting midwifery.
Yeah. So, I think I was brought here to talk about the Birth Justice Care Fund. So we'll just, focus on that. So the Birth Justice Care Fund was created at the beginning of this pandemic. We went into the year thinking we was going to do a whole set of work. And we knew that had to shift when folks were losing their jobs. Birthing people didn't stop giving babies or having babies or giving birth during a pandemic. And we knew what the maternal mortality rate or what the stories were in Georgia already before experiencing the pandemic, and that people were going to be terrified to go into hospitals. Nobody knew what to expect because we've never lived through a pandemic. So Black women didn't know what, was at stake during this pandemic to give birth in the hospital. So we decided to focus groups and conversations and circles weren't going to get it. We wanted to put some money towards the safety of Black women birthing in the South and in Georgia. So we created the fund, which awards families money to pay for a community midwife, to pay for a community doula and lactation specialist. If you weren't able to afford it yourself. And some of the barriers that we're facing already is that these community midwives aren't covered by insurance. We can't get the legislation passed to have that done. So I'm excited about what Carmen is doing in New York, so we can also learn from that and figure out how we can get that done in Georgia as well. Yeah, so that's what we've been doing, is just bridging the gap between community midwife and making it known that we are specifically focused on working with community midwives and doulas, and making sure that the community has access to these community midwives that they may not even know exist or are available to them. So yeah, we backed it up with some money and we continue to do that. 2020 this year, and then also next year in 2022, we're opening the fund for families in Kentucky. So I just wanted to lift that up. If you are birthing in Kentucky, you do have the opportunity to apply for the Birth Justice Care Fund there.
Nice. And how many families have you impacted thus far with the fund?
Close to 200. And over $200,000 has been spent on services and items. I'll say that too. Some folks just, they didn't necessarily need the services. Maybe they already got the services, but they needed diapers, or they needed wipes and car seats and strollers, just basic essential needs that folks are going to need. But when you're laid off during a pandemic, you can't do that right now. So yeah, about 200 folks.
All right now. That's amazing. That's beautiful. That's beautiful, beautiful work. I see our sister Jamara has walked in and stepped in the room. How you doing? I don't I don't know if she can. Oh, and we've lost. I don't know what's going on here. Let's see. Well, since Leah, since you mentioned the, I'm sorry, I'm just pulling up notes. Since you mentioned the work that Carmen has been doing in terms of policy for midwifery, Carmen, do you want to elaborate on a little bit of the work that you've been doing?
Sure. So on the midwifery front here in New York State, actually about 3 years ago, I want to say, a couple of us certified professional midwives who are in the state of New York, we got together, or we were brought together to talk about, like, why don't we have legislation yet? And then that became learning about the history of midwifery, not just in New York, but nationally. And the push to get licensed as certified professional midwife specifically in the late 90s, early 2000s, that happened with the establishment of MANA and MEEK and all these other things. So I don't want to get too into the history because I could get into the weeds. So fast forward about 3 years, we actually approached the state organization here in New York for licensed midwives and let them know of our intentions, because we wanted to just make sure that the midwifery community already was aware of what was going on. And we started to work with their legislative representative, trying to craft a bill that would get passed. Without getting into all of the details of that process, at some point this year, I think it was the beginning of this year, middle of the spring, a bill was actually drafted and introduced into the New York State Assembly and Senate. One of the challenges that we have found here, certified professional midwives in New York, has been that there is a long-standing history of contention and tension within the midwifery community around legislation. And then, unbeknownst to me, which I learned along the way, there was a lot of folks that didn't see it being in their best interest for certified professional midwives to actually be practicing in the state of New York. And then I actually have talked about this week. There's wanting what you want versus understanding legislation and understanding politicians, right? And as an organizer, an activist, I am very much and have always been for most of my life, like, we want what we want, how we want it, on our terms. But when you step into these boardrooms and you step into these conference rooms and you sit in front of politicians, you have to learn very quickly how to speak that language. And then you have to then start to learn who's, what's it called? Who's greasing whose hands? I think is that the phrase, right? You have to find out very quickly who's who and who has benefits with what, and what legislators are not going to budge. So here in New York State, there is a specific politician that has always dealt with midwife related topics and law, right? And so we learned, well, like, this is what we want, this is what we specifically want. And then along the way, we had to understand that, like, this is who you have to work with, because everybody else has decided that this is the person that is going to do the work on that. You can decide and die on that hill to go find somebody else, but this is the way that things work, right? And so very quickly, we had to realize, as the group that was working, which is NYCPM, that was working on this bill, we had to decide, okay, now we have to talk about what are the negotiables and non-negotiables, right? And I say this especially for folks who are looking to legislation and looking for legislation in their state, that you have to decide that at the beginning. What are your negotiables and non-negotiables? And I hate, and anybody who knows me in the chat knows that I'm like an all or nothing. I'm like, I want what I want, how I want it, however I want it. But then as I've gotten older and more mature, it's like, well, what are the things that we absolutely 100% need to get so that we can practice, knowing that we're going to get an imperfect bill, and knowing that regulation or legislation is still harmful to midwifery, no matter how you slice it, right? But then that is then paired with the fact that many of us cannot afford to be illegal. There's some folks that can, and there's some folks that can. I personally have made the decision. I know that someone asked, tell me a little bit about what you're doing midwifery-wise. I personally made the decision not to practice illegally here in New York State, because I have too much to lose, and I'm a Black woman. Like, I hate to say it, but like, we are illegal by just breathing, right, in this country. Like, all we got to do is blink, and people could bring up charges. I'm not about to then, on top of that, break the law, right, and then put myself in jeopardy and put my family in jeopardy, right? And so, I think that as we learn the reality of the legislation, now we're actually, hopefully in January, the legislative session opens back up again. And hopefully the bill that exists right now will be reintroduced, and hopefully we will get passed. One of the challenges, and I'll try to be as diplomatic as possible when I say this, is one of the challenges outside of getting people to vote on it in the Senate and in the Assembly has also been the heartbreaking reality of having to deal with sabotage from your own colleagues. And I'll leave it at that. Like, it's not just the politicians, it's also having to contend with our colleagues who have also, in many different ways, either been lukewarm about their support or have just straight up resulted to sabotage.
Thank you, Carmen, and apologies to everyone. Can you all hear me now? Okay, good. My computer had a full-blown meltdown, so thank you all for keeping the conversation going. So if I heard what you were talking about, Carmen, you were talking about the bill that you're working on in New York City. Jamara, so glad that you've been able to join us. I don't know if you've had a chance to speak yet. If not, I have a question that I think kind of dovetails nicely from what Carmen was just talking about, kind of this fight to have supportive laws in place where our people can legally provide services to our own communities. Jamara, I know you're working on a documentary. Can you tell us a little bit about your documentary? I know it covers some of the history of how we even got to a place where we're having to fight for supportive laws so that we can provide care to our own community. So if you could talk a little bit about that, I think it would be great. We can't hear Jamara. And you're unmuted too. I don't know what's going on. We can't hear you. Okay. You try what I had to shut my computer down and rejoin. Try leaving and rejoining, and then we will save this question for when you join us again. While we wait for Jamara to come back, Leah, I would love for you to talk about what Sister Song has been working on specifically with the Catching Light exhibit, because we know how valuable our Black midwives are to our communities. And so talk to us about the Catching Light exhibit, what it is and what prompted it.
Yeah. So that project was actually created by our executive director, Monica Simpson, within the organization. It actually came from during the time we were working with community midwives around the legislation to be certified, to be covered by insurance, and we were having like these sessions and really just digging into what it is their desires were. And Monica just kept looking at their hands, like she just kept being drawn to just really checking them out. And she's like, oh my God, their hands, I just can't stop looking at them. And of course, they are the ones that catch life. They are the gatekeepers, the safety net of life once they do arrive here. So Monica wanted to capture that. She wanted to highlight the stories of Black midwives and the history.
No, Leah is frozen.
You can't hear me?
Okay, you're back with us.
Okay, I was frozen. Oh, Lord. It is not Mercury retrograde. What is going on? But yeah, she wanted to document the history and the stories of Black midwifery, Black midwives in the South. That so often has not been the case. I think Carmen was mentioning about how we've been midwives since we were brought to this country. Like we've been catching life for that and before. And, being the great granddaughter of a freed slave who was a midwife in Kentucky. And the only thing that we have to remember her by is the land that was, she got a land grant deeded to her for her service with the military in Kentucky. And that's where she was a midwife. But that's all we have to remember her by. We don't have her full story of her time as a midwife during that time in Kentucky. So Monica wanted to do something to capture the photos, the stories, the impact and of the midwives that we work with here in Georgia.
Great. I'll pose this question to both of you. Leah, thinking about the work that you all are doing with the Birth Justice Fund, and then Carmen, obviously the direct services that you're providing to folks in your community. I mentioned earlier, about obstetric violence, about the disrespect and abuse that folks are experiencing. And I want to read this kind of definition of obstetric violence, just because I don't want to assume that people really understand what it means. So obstetric violence is defined as the physical, sexual, or verbal abuse, bullying, coercion, humiliation, or sexual or assault, not just sexual assault, that occurs to laboring and birthing people by medical staff. So basically, obstetric violence is any time that a person in labor or birth experiences mistreatment or disrespect of their rights, including being forced into procedures that they have not consented to. I'm curious if you all can talk a little bit about what the experiences have been of your clients or the people that you're working with in the communities. And, have you seen an increase in folks wanting access to midwives instead of birthing in hospitals? And then kind of thinking bigger picture, do you think community-based midwifery care is a potential solution, kind of in a whole tool box of solutions to addressing the how frequently Black women and birthing people experience obstetric violence in hospitals?
Mm-hmm. Who you want to go first?
You already know.
I can jump in. I'll be quick. Yeah, so I would say first of all of the above. Of course, we heard a lot of stories of all the above from the folks who did apply to the Birth Justice Care Fund. And we don't ask them, they don't have to share their story, but some choose to. And what was just kind of resounding across the applicants of the fund, just across about 80% of them, was a result of that violence, which is fear. A fear to go into these hospitals, a fear to give birth, especially during a pandemic. Again, like I mentioned before, because we just don't know what will happen. We know that we don't always make it out of those hospitals. We always don't make it out safe or unharmed. And trauma is was across the applications too. So we felt that connecting these folks with community midwives was a solution, especially since the community midwives that we work with are steeped in the RJ framework. They've signed on with the Birth Justice Care Fund as a partner to say, through this framework, this is, I do my work, and this is our step towards harm reduction. So we did think that this was going to help. And a lot of the midwives that we work with, they'll let you know, I've never lost a mother or a child in my career. That's just the standard of care that they have. So, we did think that was going to help, and it would help the community. The midwives did see an uptick in clients and folks that they saw within the last year and a half, almost 2 years now, because of the pandemic, for sure.
Thanks for sharing. Carmen?
So here in New York City, at the height of the pandemic, and the continuing pandemic, because we're still in the pandemic, even though people want to act brand new, but that's besides the point. We did see a big surge of people wanting out of hospital birth. We don't have enough home birth midwives in New York City, at least, or New York State, to be able to cover the demand. So that was one thing that we ran into fairly quickly, like pretty much like within the first couple of weeks of the pandemic starting. And the fear was, which was, I think some of you listened to Bruce McIntyre speak before already today or yesterday, that already what we were seeing before the pandemic happening to Black women just intensified because the telehealth came into play. There was a lack of even more thoroughness. If we were already dealing with less thoroughness, that went down, right? And so they also, towards the beginning, did not allow folks to have support people with them in certain situations. So when we're talking about obstetrical violence, right, now folks were unchecked. Completely unchecked, right? Because nobody was there watching until there was work within the doula community to get that changed. On the side of the community midwifery thing, what I can say is the following: that home birth should not, in my opinion, be approached from a fear-based place, right? And so when I saw many people wanting to gravitate to home birth, I was glad for it. But I saw it as a reaction as opposed to like, this is something that I already had wanted and prepared for. And that's something that midwives had to figure out very quickly, or like, how do we support people that rightfully want to have a birth in a different location, but it's actually more jeopardizing and can potentially be more traumatic to someone who is not ready for an out-of-hospital birth, to have an out-of-hospital birth, right? So there was that. The other thing is that we have one birth center here in New York City, And I actually during the pandemic, that's the only time that I was in a midwifery space. Like I said earlier, I've chosen not to practice midwifery in New York State, but I did join the staff as to serve in the birth assistant role, because I don't care. Like, if you need my help and you need my hand, you could call me the person who's getting the stuff from the corner, birth assistant. Like, I'm not tied to it. Like, I'm here to do what I gotta do. We saw an influx of people wanting to go to the birth center, and then later for myself, found out how deeply unsafe it was to also give birth at this location, because the thing about community midwifery that I have to drive home for folks is that it's not enough to have practice in a hospital, step out of the hospital, and then decide to go into the community midwifery home birth realm. Like, there is, and the midwives here can speak to this, there is a whole level of training and assessment to be able to handle an out-of-hospital birth that you have to learn after you've walked out of a hospital. Because in a hospital, you have, although yes, we still are at risk for danger, you have fail safes, right? So you have people, you have machines, you have an ability to press cold glue if necessary, right? Like, and then you have to unlearn, even as much as you may understand it in your heart, you have to unlearn the pathologization of birth at the same time, right? So that's what I was observing when I was in the birth center. Then, like, these midwives are just practicing here, but they're still hospital midwives, which means that the most informed person in the room can't even fully practice because she's following the law. So when I say that I've practiced community midwifery, I'm what in our urban vernacular we say the plug. I get to help people figure out this maze. I refer people, and I also think about the whole person and the whole family, right? And that's another, when I was defining community midwifery, that's another aspect of community midwifery, where it's like, it's not just let's get this baby out of you. It's, do you, like we were speaking before, do you need diapers? Do you need wipes? Are you gonna need WIC? Are you going to need food stamps? Are you going to need food? Like, do you need lactation support, right? And so I still use the knowledge and the connections that I had have been using it during this pandemic. And actually, the collective that I'm part of, actually, we started it in the pandemic because there was this huge gap that was not being addressed for mothers and families that didn't have diapers or wipes or all these other things. So anyway, just to wrap it up, because I actually want to hear Jamara speak. We can be the part of the solution, but until we have community midwifery and a bunch of other things, but namely what I see is a full integration of midwifery into what we do, it will still be unsafe. Even for midwives, we won't be able to handle the capacity, right? And we also then risk our clients becoming traumatized. They do need to interface with the hospital, with the hostility that we may face, right? Bringing our clients there because we have identified that this person needs to remain safe and that it probably is safer for them to continue their care in a hospital setting, even though we know, right, like that they may still face some type of like macroaggressive violence. It is still within our scope and our duty to refer if we see that there's a situation that really would just make this a matter of life and death. So the other piece, and I'm sorry, I'm gonna wrap it up, is that the same way that we say all skin folk ain't my kinfolk, I say the same thing about midwives. All my midwife folk ain't my kinfolk. And what I mean by that is that not all midwives, and this can be based on race and class and privilege, are completely safe. Because within our ranks, we have folks that are ableist, We have folks that are transphobic, right? Homophobic, who may be classist, who may play respectability politics, right? And or have their own unprocessed trauma that they are also putting forth on the client, or maybe anti-science and not be actually and are also rejecting evidence-based practice, right? And so when we're talking about community midwifery, we have to also, as community midwives, hold the standard for folks who are also outside the hospital. Outside the hospital doesn't mean that we start being anti-science. It doesn't mean that we stop following protocols or OSHA or all these other things, right? And that's another point that we also have to speak about, right? That it's not just, hey, give birth outside of the hospital in your home, but do we have folks that are trained and also ethical, right? Because when we think about even like traditional midwives who may have never stepped foot in a meek school or whatever, then we talk about ethics. How ethical are you in keeping the safety of this community and the profession and your other fellow midwives?
No, thank you for that, Carmen. Jamara, I want to make space for you to respond to this question as well, if you'd like. Basically, I was just asking them to share, what have been the experiences of your clients as they are, if they've had experiences in hospital settings, what's driving them to want access to community-based midwifery care, and whether or not you think midwifery care is a tool to combating obstetric violence. Still can't hear. Oh, all right. I don't know what to do, Jamara. No. Okay. Try joining one more time, rejoin one more time. This time, don't put it on mute, and see if, just as soon as you get back, start talking, and we will pause for you, okay? Jamara has such good information, and I definitely want to hear it. So try rejoining us. Okay. So, Leah, I know you touched a little bit on the Birth Justice Fund, but I would definitely want to give you space to share anything else that you want to about the Birth Justice Fund. Let folks know, what area are you covering with it? Who's eligible to request support? Hold on, let's see. Jamara?
Can you hear me?
Yes. Okay, so don't be on mute. We're just going to leave you unmuted this whole time. Leah, I'm going to come back to you, okay?
All right. Time is a charm.
Oh, there we go.
Where did y'all go?
We hear you. You may not hear. Oh, no. I told Jamara not to touch anything. Okay. We're going to see if she joins us in a minute. Leah, I'll go ahead and jump over to you with the Birth Justice Fund.
Yeah, I really wanted to hear from Jamara too. Oh, man. Well, something new that we're doing this year with the fund, we had a panel recently, about a month or two ago, on queer, trans, non-binary parenting. I think Jamara's back.
Okay.
I don't know what's happening. I don't even know.
All right. Well, it's on you. We're gonna chat. We're gonna capture your thoughts right now.
As long as I can, I'll be here. So the question was about obstetric violence and why people are choosing out of hospital birth, right?
Yes.
Okay. So yeah, I mean, my sister Carmen over there, I'm just over here, seconding everything that she's saying. So I appreciate it. But yeah, a lot of people are choosing out of hospital birth because of the pandemic, not wanting to be exposed to COVID, not wanting to be exposed to the restrictive policies of COVID, not being able to have their doulas with them. And then also at the same time, the amazing work that organizations like Black Mamas Matter Alliance have been doing to really uplift the awareness of maternal mortality and morbidity. More Black women are just, aware and saying, I actually don't want to be exposed to providers who don't, consider me a person or don't take my pain seriously. So in Florida too, I'm based in Miami, Florida. We've definitely seen an increase in the number of people wanting to birth out of hospital and homes and birth centers. And, I was seeing a lot of discussion going on in the chat. So I'm not exactly sure in terms of audience, like who's with us, but just basically, home birth is a safe option for many birthing people, for most birthing people, actually. Birth centers are also a safe option for most birthing people. Midwives, part of what we do is diagnostic care. We screen people for any potential complications. And so that way, if there's a person who, this person really needs to deliver in the hospital, through adequate prenatal care, we can figure out what that is. And even in Florida, we even have like a risk assessment that we complete for each of our clients that tells us, who's low risk and who might need to be seen by a physician to either be cleared for home birth or to, be told that they need to go to the hospital. So there's many states, not all states, but many states have processes in place to try to keep birth safe. And birth is safe at home and birth centers when it's well resourced, when providers have access to adequate training, and when there's a transport system in place. So meaning like if someone becomes high risk in the course of labor or birth, then we as midwives we know who to call. Those providers are going to accept our clients. And our clients, feel that there's a continuity of care. So either we can go with them or we're able to communicate with the provider that we're handing off to. So there's lots of things that can be done to, make the process as safe as possible. And most of that involves centering, integrating, uplifting, and resourcing midwifery care.
That's great. Jamara, while we have you here, I would love to hear more about the documentary you've been working on. And I can drop in the chat the link while you're talking, just so folks know where they can access information about it. So tell us all about it. When can we expect it to come out? And let folks know how they can support.
The $1 million question. When is it coming out? When it's done? I wish I had a date, but I don't yet. But to this point, Legacy Power Voice, Movements in Black Midwifery, we have interviewed 23 Black midwives in 5 states. So Florida, Georgia, Alabama, Mississippi, and Louisiana. Most of that, actually all of those interviews have taken place during the pandemic. We've had 3 trips in an RV across the South. It's been a lot of fun talking to midwives in different parts of the South. The director of the film, Kay Sanderson, is an incredible visionary visually, and we have some stunning, really, really stunning footage that we're now kind of going through and just kind of looking at the possibility of making this a docuseries so that we can get it out sooner. 23 is a lot of midwives. This is a huge story to tell. We're still filming. So even last weekend, midwife Michelle Drew came to Miami, and we hung out at the Black Archives, which is the historical archive here in Miami, and looked through documents and original artifacts from Black midwives of the 1800s and early 1900s. So our concept is really legacy, right? So we're looking at what has happened with midwifery. How did we get to this point? We know that midwives, have been the primary care providers for pregnancy for most of human history. And then that started to shift in the early 1900s. And that had a lot to do with, white women getting the vote and then wanting to kind of have control and power over birth, and white male doctors wanting to also have that control over birth. And it was really, it coincided with trends that were, about anti-abortion and the women's bodies really being a site of political maneuverings, and Black women being, the primary care providers for most people in the South, most people, period, in the South. At that time were really, painted as being, not qualified or, there's dirty fingernails campaigns led by the American Medical Association. So we're telling that story, the legacy story, Part of that legacy is also how are we reclaiming that? How have we been reclaiming that? So what I call the Black Power generation of midwifery, the midwives like Mama Shafia, Ayana Ade, Salama, that came about, Nanko Leku, may she rest in peace, that came about in the 80s, that really reclaimed these traditions and found each other, connected with each other, and began to rebuild, Black midwife movement. And so we're telling their stories. And then the power piece is really about midwives who are now today doing things like Stephanie Mitchell in Alabama, Birth Sanctuary, establishing a birth center in a community that doesn't have one, in a state where there's all these laws that are trying to prevent Black midwives, that were designed to prevent Black midwives from serving our communities, but still, working to establish a birth center in the face of that uphill battle. And midwives like Maria Milton up in the Panhandle of Florida, who has had a birth center there for years, in what we might consider hostile territory, Trump County, and how a Black midwife survives in that. So those have been some incredibly powerful stories that we're collecting. We're also trying to really tell this broad story of the robustness of midwives' lives, right? So many of us are also activists, artists. We serve our communities in lots of different ways. So we also have a lot of, what we call B-roll, or just following people in their lives and getting what they do. Like, there's midwives who are chefs, midwives who are musicians, Black midwives who are like taking on an entire city to try to transform what maternity care looks like. So we're telling that story of the activism and the richness really of midwives' lives. So there's so many stories. I mean, I could go on, and you can see the trailers on our website at legacypowervoice.org. We also have our ancestor wall there, and we're going to be adding more names there. And if you have names, to add, please email us or contact us through the website, because we're always adding to the ancestor wall. When we were at the Black Archive last weekend, I learned about 15 Black midwives whose names I didn't know from South Florida that were practicing in the first half of the 20th century. So I'm really a nerd for this kind of stuff. And every time I learn the name of another ancestor midwife, it's just amazing, because, we know that our ancestors gave us so much of a gift of these traditions. Our ancestors taught everyone in this country how to give birth, and then they were pushed out very thanklessly. And so we do this to uplift and honor, some of our ancestors whose names we know and the ones we don't know. So yes, please go and check us out, watch the trailers, and support the documentary. Thank you for the time. I'm glad y'all can hear me now.
Yes. And someone asked for the name of the website again. Tell them once again, Jamara.
LegacyPowerVoice.org. LegacyPowerVoice.org.
Thank you. So we want to make time for audience questions, but while you all are dropping them in the chat, or I don't know if people are allowed to come on live, Leah, I want you to go ahead and finish your thought about the Birth Justice Fund and how folks can support.
What was my thought? Oh, yes, my thought, yes. I was saying that this year we did this panel on queer, trans, and trans non-binary folks birthing and creating family. And we had such a huge turnout that we wanted to make sure that it's clear to folks that the Birth Justice Care Fund does support that as well with money. So we want folks who are birthing and building family, who are a part of that community, to make sure that they have the midwives and the doula support and the lactation support, chest feeding support that they want. So we're putting up, I think it's $30,000, $40,000 aside for that specifically. It's something we're doing in 2022. It's in the budget, and I think that was all that I wanted to say about the fund.
Can people donate to the Birth Justice Fund? Can they
Hell
donate?
yeah.
Okay. Leah, you got to tell them how they can donate.
Yes, I'm sorry, my bad. Okay, sistersong.net. You can go to our website and you'll see the directory, the list of the birth workers that we work with. You'll see how to apply for the Birth Justice Care Fund, and you'll also see how to donate. Of course, you can, if you want to do a large donation and you don't want to do it through PayPal, you can just email me at leah@sistersong.net. But I think it's just PayPal on the website. If you want to you can do a monthly thing, you can do a one-time thing, but definitely please donate to the Birth Justice Care Fund. And again, I want to say that it's opening up in Kentucky. So if you're in Kentucky, you want to apply, or if you want to donate, please feel free to get connected through our website.
That's great. Don't forget, audience, if you have any questions for the panel, grab the mic, and then you can come on camera with us and ask your question. While we wait for that, I do have one more question for you all. We have a lot of doulas, obviously, that are attending the conference. And so as we think about midwifery care being supported by doulas, what does that look like? So how can doulas and midwives best work together, both in the birth work piece of it, but also in the advocacy piece, as we're trying to figure out how to create more supportive laws, more supportive structures to expand access to midwifery care? What's the role of the doula? And anyone can answer this. Does anybody?
Any of us can answer?
Yeah,
okay.
Go ahead, Jamar.
Sorry, I was putting my social information in the chat. So I really think of midwives and doulas as being a team. And, I often work with doulas. I really think a complete team is for an out-of-hospital birth is at the very minimum, a midwife, a birth assistant, and a doula. And so, we all work together because we're holding different pieces. And I think that the more that there is access to midwifery, it also gives doulas a more places to have safe births, because many doulas are traumatized by the births that they witness within hospital settings. And I talk to a lot of doulas. I'm not a doula, but I'm a doula trainer. We train doulas at Southern Birth Justice Network. And I talk to a lot of doulas that, that have to go and, kind of heal themselves after witnessing some of these traumas, particularly doulas that are serving Black and Indigenous communities. So I think that the more we have access to midwifery and the more we have safe spaces for everyone to be and to be respected, then, that helps build the doula sustainability as well. And I think that a lot of the same workforce issues that exist in midwifery also exist in the doula world. So like not having enough of doulas of color, and, needing more trainings that are inclusive. The transphobia, homophobia, all of that exists in birth work in general. And so I think that midwives and doulas uniting around the things that, that affect all of us is important. So here in Miami, we have just launched our Miami Birth Justice Initiative, which if you go to @Southern Birth Justice on IG, you can watch the press conference that we did just on Thursday. And this is a campaign really being led by midwives and doulas, most of whom are Black and queer. And we are compelling hospitals to, allow doulas to come back in, to make sure that the doula is part of the birth team, right? And to make sure that everyone, birthing in a hospital is aware of their birth options so that they have access to a midwife and a doula. And we're fighting for the same things, really, which is access, for it to be covered by, Medicaid, for there to be a broader workforce, for there to be more equity in our fields. So there's a lot of things that I think are in common. And one of the things that we've done at Southern Birth Justice Network is really take a midwifery lens and approach to doula training, because many doula trainings are very short. They're just a day or a weekend. And then you kind of have to figure it out on your own. And so we've taken our doulas into a year-long cohort, because a lot of those skills don't just come they come through experience, but the experience needs to be mentored, needs to be hands-on. You need to have a place to kind of check in, a home base, if you will. And so our cohort kind of becomes like a tribe. And so it's, when you think about like the history, again, I'm returning to legacy. We don't have a long, long history of doulas, right? Doulas came into existence as even a concept because of the way that birth was moved out of community. Your doula used to be your mama, your auntie, or whoever was helping the midwife. And midwives often doula, like we often do a lot of doulaing. And so there's so much crossover. And so to just understand, how doulas even came to be, knowing that it came out of midwifery and it came out of midwifery being marginalized. And that, many midwives start as doulas. So there's just so much overlap and crossover. When I hear that there's like, I don't know, whatever things between midwives and doulas, I'm like, we're on the same team. Like, come on, y'all, let's build. So yeah, that's my 2 cents.
Thanks. Carmen or Leah, anything you want to add?
I think Jamara really encapsulated it all for me, and I think what I've come into contact with that I want doulas to recognize on the same like last line of Jamara's statement that we're on the same team is really that because I think so often over the last at least 10 years since I was trained as a doula and then became a midwife, we often as doulas become the shield for our families, and that means against everybody, right, including midwives at times. And so I think that having an understanding with us that even we may make a call that the doula doesn't like as well, right, and not becoming adversarial or leading our client to also become adversarial with us. I think another thing that with doulas as well is practicing within your scope helps us who are out of hospital, because if something should occur when you are practicing out of scope as a doula, it's not just you who goes down or becomes marginalized or becomes put under a microscope. It then adds to the narrative that the American Medical Association doesn't need any more help making bigger, right? So basically, as we say in the urban vernacular, doulas also need to stay in their lane for us to work together and keep people safe. And then on a like support level with legislation, I think also just learning like what is it that's going on in the midwifery community in your particular state or in your particular community, and ask and like try and figure out in what way can we further this, in what way can we help the midwives, because oftentimes midwives are trying to push policy, but they, the legislators or politicians are like, we don't want to hear from the midwives, right? They want to hear from the constituents. They want to hear from the consumers, because now this entire thing is not even about human rights, it's about consumer rights, right? So how do we have doulas on our team that understand the value of midwifery, also help us get more constituent voices of people that can speak for us, because they will dismiss us very quickly. But if a whole flock of birthing families and doulas walk into the building, they have no choice but to listen. So I would love to see just more support and more like, again, this idea of like, we're on the same team. We're trying to reach the same ends, and we don't have to do this linear violence thing against each other. If we come to a common understanding that we want you in the room, while I'm doing fetal heart tones, I can't really be, helping mom or person come back into their body. I need you to help me do that while I'm listening, right? Or while I'm doing whatever it is that I need to do to keep them safe. So I see a lot of value, and I just hope that we continue to work together.
Thank you for that. I just want to add really quickly, because I realized that in my excitement to talk to you all today, I did not introduce myself. So I'm Brianna Lipscomb. I'm the senior advisor of the maternal health and rights at the Center for Reproductive Rights. And the reason I'm even part of this conversation today is because as part of our advocacy priorities to expand access to care, one critical way we think we can do that is by expanding access to midwifery care. And so we are working really intentionally to expand and advocate for more supportive policies in the states. We have a very disjointed system of laws from state to state. And so as you all are exploring what the laws are in your state, we would love to help provide some assistance to you all as you're doing that, technical assistance, helping you figure out what's going to work in your state. So just plugging that. You can reach me at blipscomb@reprorights.org. I'll drop it in the chat box, but just wanted to introduce myself since I failed to do so. Chanel has come on, so that means our time has lapsed, but I just want to thank all of our panelists for their time. So Chanel, I'll turn it over to you.
First, I want to give thanks for, all of you working through the technical issues and being present. I don't know if you even know if Jamara remembers. I first met Jamara at a midwifery conference back in I think it was 2009. Yeah, I think it was 2009. And I was a baby doula, just starting out, and she opened up her arms to me, and we've talked over the years. And so want to give thanks for you being on this platform. And, we don't understand the connections that we're going to make with folks, and how they're going to guide us through our circles of support along the years. And so please, as it was mentioned earlier, be humble in the work that you do. And as you walk through this, this space, honor midwives. They play a huge role in the work that we do, in not just creating space for us and as birth workers, but just as providing continuity of care for our families and for our communities in so many different ways. And so I want to thank you all for being present and for sharing your knowledge and your wisdom. Please, folks, check out the afternoon panels. I want to thank the Center for Reproductive Rights for sponsoring the two panels that we had throughout the conference. And thank you all again. So I'll see you soon. Peace, peace, peace.
Thank you.